Hi, everyone. Thanks for joining us today for a fireside chat with Steve, the wonderful founder of Presuna. Thank you, Steve, for making some time in your busy schedule to come join us as well. Just a couple of housekeeping items before we start. As you'll have noticed as you're coming in, we are recording this event and we will make that recording available after the event. And if you have any questions, please feel free to drop them in the chat during the event. And if we have time, we will try and get to as many as we possibly can. Without further ado, I would like to introduce Steve Reid, who at the Funding Catalyst team here at Thin Air Labs, we've been working with for the last couple of months to navigate the different non-dilutive funding opportunities that are available to him. So Steve, thanks so much for coming and joining us today. I really want to just open the floor to you and give you 3 minutes to talk about whatever you want about Presuna. So please take it away.
Sure. Yeah, thanks for having me. So I guess I can just give you an overview of what we're trying to do with Presuna, what we're working on, what we're trying to work towards here. Essentially, what we're developing is technology to accelerate the accessibility of ultrasound-guided therapies for as many people as possible, wherever they are in the world. There's 3 reasons why I think this is a pretty important thing to work on. Number one, chronic conditions are actually a really big problem out there in the world, and they've been getting exponentially worse for a pretty long time. There's a pretty staggering statistic that in 2016, there was approximately 1.45 billion years of healthy years lost of life. That's represented as a disability adjusted life year, a DALY. That's a pretty large number, 1.45 billion years of lost life in a single year of healthy lost life. And that's a pretty immense amount of suffering that the world is continuing to exponentially increase in. They also attribute to a large percentage of global deaths each year. So I think it's almost 3/4 of global deaths can be attributed to chronic disease, according to the World Health Organization. And in terms of if you want to put a dollar on it, there's about $30 trillion in lost economic productivity from 2010 to 2030. That's kind of a history plus projected economic loss. So it's a very large problem, just to sum it up. And that's the macro level. Kind of go into the more personal level, those that live with chronic diseases, a lot of them, there's a large gradient of what people experience, but a lot of them don't live the same life they used to. That could be just things like not being able to go do some kind of activity that they're not used to doing, but there's also kind of a lot of psychological negative impacts that people experience too, and this radiates to everyone in their life that they're close with. So friends and family, their relationships change sometimes, and oftentimes those people have a hard time remaining in that relationship just because the nature of their relationship has changed. So it's not only a big problem at the economic macro level, but kind of at the more personal level, it really changes people's lives, and sometimes they can't get back to where they used to. And essentially, that even though this is a big problem, the current healthcare delivery models can't actually solve the problem, as far as I can tell. There's just too many people that have these conditions out in the community away from the hospitals, and they can't spend their lives in the hospitals where all the medical care currently is. And so really there's kind of a need for better healthcare delivery models out in the community setting to really help these people that are living with these chronic conditions out in their homes or even in kind of assisted living facilities. And so really that's kind of the 3 main reasons we think this is an important thing to work on. And really the reason that we're choosing ultrasound is the technology is that it's been going through a pretty rapid shift in terms of democratization over the last handful of years. So a lot of people don't know this, but now you can buy an ultrasound device for about $2,000, and you can plug it into a smartphone, and you can just start scanning and seeing what's going on. So essentially with that, it's starting to move out of the hospitals and into the community setting with primary physicians and a lot of different specialties out in the community setting. And a lot of people are starting to experiment what they can actually do with it, which there's been some pretty interesting results. Ultrasound guided therapy, for those that don't know, is just the idea of looking at ultrasounds over time and then seeing how different features change, correlating with the severity of a condition, and then using that to kind of see if you should trigger an intervention, and then if you should, what the impact of that intervention is by seeing if it has a positive or negative trending line after that. And so there's been some really interesting results that have been published from a research setting using ultrasound to guide therapy for congestive heart failure. And with congestive heart failure, what happens is the kind of inefficiency of the heart pumping actually results in blood being backed up into the lungs, and then the lungs start to fill with fluid. And then the effect of the lungs filling with fluid actually causes a lot of hospital readmissions and poor quality of life and sometimes death. And so the good thing about ultrasound is you can actually have a high sensitivity in terms of detecting fluid in the lungs. So there's been a very interesting few studies that show about 12 to 16% hospital readmission reductions versus just using the physical exam compared to using ultrasound in the physical exam as well. So the big problem is that these are kind of constrained to the research studies. The amount of analysis that you have to do to actually do an ultrasound guided therapy effectively is just too burdensome to do in normal clinical practices. So really what we're developing is a way to actually automate pretty much all the analysis of it that's possible, and to make the whole kind of workflow really easy so that you can apply this to, first off, congestive heart failure, but there's just so many different other diseases you can apply this to because you can really ultrasound lots of different parts of the body. So number one, we're developing technology to make that easier and to automate a lot of the analysis behind it. Number two, we've learned that there's actually a pretty big barrier to use ultrasound in terms of acquiring the competency to use it. So now that there's a lower threshold in terms of cost to actually acquire an ultrasound device, the biggest barrier is still people learning how to use it effectively and getting access to experts that can actually help train them. So that's another area that we're working on, trying to make easier for people. And then thirdly, just the whole cost of actually doing research studies for applying this to other disease states in the future is immense. The amount of scans you have to get and the amount of time is pretty immense. So we're looking at ways that we can actually significantly reduce the cost of doing research to come up with new ultrasound guided therapies for a lot of the different diseases that we think it can be applied to in the chronic disease states. So that's a summary of what we're working on, why I think it's important, and what we're trying to focus on here.
That's incredible, Steve. I think it's clear that, you know, the technology that you're building really could address a massive problem in the not just chronic disease industry, but across a lot of healthcare. But I'm really curious, your previous startups were, you know, technology companies in the energy sector. What motivated you to jump into starting a health venture?
Yeah, totally. So I was pretty invested in the energy space for a while, and partway through the last startup I was a part of, I ended up contracting a pretty bad viral disease called viral meningitis. And it's a pretty bad one. You essentially have to stop working for a while. And unfortunately with mine, it turned into a kind of a post-viral chronic condition that took me about 2 years to fully recover from. Through that time, it was lots of ups and downs, trying to figure out the right way to actually get myself back to a healthy state. After doing lots of research, I learned that a lot of people with that disease that I still have, they get a pretty severe form where they're actually bedbound for the rest of their life. And it's a pretty hard thing to get out of, but luckily I was able to get out of it, kind of get back to a healthy state. So really what motivated me was kind of going through that process. I was really just looking for ways I could kind of help guide therapy for myself, because I just wasn't getting the help that I needed from the medical system, just because it wasn't like an acute condition that needed help right away. And so I was trying to find ways I could actually use medical imaging to just kind of see if I was getting better or worse in certain areas, because you could pick up potentially like inflammation within the brain, or maybe some other features that could kind of cue if things are getting better or worse, and if certain treatments are actually working. And just found that there wasn't really any way to do that. So I tried to get lots of different ultrasounds, couldn't even get an ultrasound. I ended up getting one MRI over the course of 2 years, which I didn't have another MRI, so I couldn't see if it was getting better or worse. So basically coming out of that, I was just pretty motivated to actually go and help other people with chronic conditions, gain a lot of empathy towards what it's like living with one. And I think there's a lot of suffering that people don't talk about with people living with these diseases that I really want to help kind of make people's lives better and get back to a normal state. So that's what motivated me to start working on this. And I just think there's so much potential in terms of what you can do with medical imaging and looking at where ultrasound's been taking itself over the last number of years. I think the accessibility is just getting pretty tremendous in terms of anyone can eventually get access to one of these things, I think. And what's missing is just the ability to actually guide therapy with it at this point.
That's an incredible like founder story, and how personally connected you are to this issue at hand. Were you really shocked to see, you obviously had your personal connection to it and your personal suffering through the viral meningitis. Were you shocked to see how big the actual problem was in the healthcare system?
Oh, totally. Yeah. Because as I said, I was in the energy industry before, so I didn't quite know the kind of what was going on with healthcare and what the big problems were. But after looking into it, I was pretty amazed. Just that one statistic, 1.5 billion years of healthy years, healthy years lost of life per year is pretty crazy. So yeah, I think there's a lot more going on in terms of the problems of the chronic conditions than I had initially imagined.
Yeah, for sure. And we actually have a question from the audience coming in already. Someone's asking, with what you're building, what's been the biggest problem with adoption in the industry? Are the barriers harder through regulatory bodies, or is it the users that are the barriers?
Yeah, it's mostly regulatory. So that's what I've learned about the healthcare industry is there's just very high regulatory barriers to getting adoption. A lot of people, there's early adopters that are willing to try out without kind of they kind of forego the regulatory barriers to try it out. But a lot of people always resort to kind of like patient privacy and just different standards of regulatory bodies you have to hit before they're even willing to take a look at it. So that was the initial challenge, is just figuring out the right product that you can actually be excluded from these regulatory bodies and you can actually benefit people directly. So that's where we're working on right now is kind of a direct clinician sales model and product for these clinicians that they can purchase individually themselves, which has really, really helped accelerate things initially here for us.
Awesome. And do you have some early adopters already?
Yeah, so we just released a beta a few months ago, and we're operating at a very small scale right now because we're still in the pretty early stages of our development here. But we have 4 clinical groups, mostly in the US, that are using the beta program right now. And we're just looking for lots of good feedback from them right now and kind of trying to tweak the product before we give it out to more people at this point. But yeah, 4 groups that are paying for it right now. And so far, great feedback.
Oh, that's awesome to see such early traction. And it's interesting, Steve, I obviously know, the strategy that you're using to build Presuna, but you're choosing, the route of investing some of your own capital, focusing on non-dilutive or grant funding that's out there and generating this early revenue to really fuel your building. How did you think strategically about bringing in capital or not bringing in private capital? And why did you choose to go down that route?
Yeah, definitely. That's a pretty important question you have to ask yourself and come up with an answer to when you're starting these things. Because it's either you go down the venture capital routes, get lots of private funding, or you kind of bootstrap it. It's kind of like the main kind of decision point. So for me, I just think a lot about, for me, this is a very long-term thing I want to work on. So I have like a 10-year horizon at least to work on this. And I just want to get there in the most sustainable way possible. And especially in these early stages, there's a lot of trial and error that you have to go through to really figure out product market fit, figure out your pathway, especially in the healthcare industry, figure out the regulatory framework, because that has some pretty harsh constraints about what you can and can't do. So really, I just thought about, what's our mission, accelerating equitable access to ultrasound guided therapies. What's the future state or future technology that we would like to build to enable that? And then essentially what kind of 3 key activities that we would need to work on to efficiently move towards this. And really that came down to, we need to do a clinical feasibility study for congestive heart failure to start getting the data to prove to people that this can be done. It both improves patient lives, reduces hospital readmissions, increases capacity in the healthcare system, is economically feasible, is feasible from a workflow perspective. Number 2, we wanted to actually go out and start commercializing an initial product that was kind of outside of the traditional regulatory barriers so that we could get some early revenue for our business. And then number 3, we actually had to we wanted to start addressing some of the more technical limitations in terms of feasibility on the analysis side. So trying to do some R&D into artificial intelligence to start automating some of the interpretation that's required. So really, I just thought about it in terms of, can we do all these things in parallel, or do we have to kind of go get some revenue first and then start investing that? And essentially, it came down to it would be most beneficial if we could do those three things in parallel. And to do that, we needed to bring in some capital. And we didn't want to go and get dilutive funding because we just needed to be very adaptable right now because we're in such an early stage. So that's kind of why we ended up going this route of non-dilutive funding. It allowed us to kind of execute these three things in parallel and really move things forward for us without a lot of the strings attached with early stage funding from like a private group.
Yeah, for sure. And do you find with this approach that there's kind of difficulties that are unique to not going after the private capital route and staying in this kind of lean development mode that you're in?
Yeah, I'd say there are some difficulties. The pros for me definitely outweigh the difficulties. Say the difficulties, number one, if you kind of haven't been through this before, you can come up with these ideas to go get grant funding from government agencies. And sometimes like 4 months down the line, once you actually get awarded, it turns out you don't need to do that anymore, but you have to kind of execute that plan. So you have to be really careful about what you actually decide to commit to from a government agency standpoint. And luckily for us, everything has been very in line with the mission and what we need to work on next. So for us, that hasn't been a negative. I'd say mostly the negative is just resource availability. So there's lots going on. Like this isn't a full-time thing for me at this point. And just the ability to actually execute all this you have to get very resourceful and very, very efficient with your time. And the only real negative is you just don't have the people on your side to actually do everything that's needed to get done. So,
Sure.
But it's part of the struggle. I mean, like it's more rewarding going through all that, I'd say.
Yeah, totally. And I think you raised a great point there about, not forcing yourself to fit a grant, but making a grant kind of supplement your journey and a true path for a venture, which I think it's always a hard thing when there's grant funding available out there. You want to chase it, right? But it's not always the right opportunity for you. But I did want to ask, when you were going down this kind of grant route and non-dilutive capital, you were looking for some outside support. And, this is how we came to work together. Why did you need the help to go after it? And what made you seek out going after some help?
Yeah, totally. So going through these grants and the application process itself is very time consuming. And as I said, since this isn't a full-time thing for me yet, I'm trying to spend as much time as I can talking to clinicians, getting feedback and actually developing the products. So trying to maximize my time doing that because that's really important in terms of figuring out the right way to actually get this adopted. And so if you were to do a grant, it kind of like each application can take like a week out of your schedule, and it's not certain that's actually going to get approved. And you kind of need to have the right terminology and right kind of approach with actually going through the application process. So Thin Air Labs seemed like just talking with you and Andrew, you both have been through this a lot, and you kind of know what the right things to say are to the right agencies, and can kind of structure the wording in a very good way that makes the receiving agency really understand what you're trying to do. And just taking the amount of time it takes to write that off my plate was kind of the big thing too. So it probably saved me like months of work, which was awesome.
Oh, that's great to hear. We really enjoyed working with you and we were glad we could be helpful. I'm interested actually, your background, we've touched on it already, is in the kind of the energy sector. Do you find it a lot more challenging to write grants or content in this kind of health space?
Definitely. Yeah. There's a whole new lingo you have to learn in terminology. And like, it was funny. I was just thinking back to when I was kind of coming out of my disease, getting back to health. I spent a year just like reading a medical publication a day. So I probably read about 300 medical publications in this area. And going through that, I was just like, there's so many words I had to learn, and just getting the right kind of terminology in place so I could actually start communicating intelligently with clinicians to actually start conversations. So yeah, you have to be really careful what you say too. You don't want to make claims that are false in the medical industry because you can lose trust really fast. So that's another kind of difficult thing with this versus the energy industry. So it's just kind of a bit more kind of complex in terms of the terminology, and you really have to be careful about what you say and what you claim to be able to do, essentially.
Yeah, absolutely. It's definitely very very strict, the health sector, and even within the science of what are you allowed to say. And I think that's, it's such a great approach you're taking with all of these like clinical validation studies you're doing, and the all of that work that's going into it. I think it's necessary and super valid. We have another question actually coming from the audience. So how are you quantifying your ROI in this product? Since the US billing code's different from Canadian billing codes, are you inclined to target the American market versus the Canadian market?
Yeah, that was a good question. So we're taking a pretty unique approach to initially get into the healthcare market. So we don't actually have to adhere to any kind of billing codes right now. We've designed a product that actually is sold directly to clinicians and they pay out of their own pockets. So we don't have to actually worry about reimbursements, and the cost is quite low per user. So they're willing to dish it out right now. Eventually, once we get into the more kind of clinical medical grade applications, we'll have to look at billing codes, which it does seem like the US is more advanced in that, like their telemedicine infrastructure is a lot more advanced. They have more billing codes for more types of things, and it's easier to kind of get reimbursed in the private industry almost. So
yeah,
the US is kind of a higher probability of adoption for us, but we definitely want to look at Canada as well, because all the people I know are from Canada essentially, and I want to help friends and family here too.
Yeah, totally. And I know, you're not even restricted just to Canada or the US, right? There's international interest in a technology like this as well, right?
Yeah, and what's really cool with ultrasound, as I was saying, since it's democratized, there's actually a really big opportunity to help the remote ultrasound programs that are starting to pop up around the world. So a lot of these clinicians are who are kind of well-versed in ultrasound. They have a lot of motivation to help people in kind of low middle income countries. So we're actually starting to work with some people that are doing that we can actually help with lots of different countries around the world that aren't kind of as well off as Canada and the US. And there's a lot less kind of barriers to adoption in those areas too. So people just don't even have access to medical imaging in the first place down there. So even just putting an ultrasound device down there is pretty immense to start with.
Yeah, absolutely. What would you say, Steve, are the kind of switching gears a little bit to operating a startup within Alberta? What would you say kind of the best and maybe the worst parts of operating in Alberta are right now?
Best and worst. So yeah, I'd say versus Alberta is actually a very good place to start a new technology company. Alberta and the kind of federal government are very good about funding technology here in Canada. And I've just been talking with a few people down in the States, and it's actually really hard to get the kind of funding that we're getting up here in Canada down in the States. From a non-dilutive standpoint, there's probably a bit more VC money down in the States.
Yeah.
So that's one huge pro is getting non-dilutive funding is a lot. There's just a lot more opportunity up here for that, which is a super big help at this stage. Alberta itself is kind of, I've kind of been with the technology industry for a while here in Alberta, and it's starting to really hit its stride right now, I think. So Alberta in general, there's a lot of excitement around kind of people trying to help people out, and it's turning into a lot more collaborative kind of space, whereas let's say like 5 to 10 years ago people are kind of being siloed and being very competitive, whereas now we're trying to operate as one cohesive organization, it seems like, within Alberta to try to move technology forward in a lot of areas. So I actually don't have anything bad to say about Alberta. It's a pretty awesome place to do this in.
Yeah, for sure. And it's certainly, I think innovation is really on the rise here. People are really starting to pay attention to Alberta now and see this as, the next place where we could really grow the innovation ecosystem here. And it's an exciting place to be right now, I think.
Definitely.
Yeah. I have another question here. With a lot of founders, they invest a lot of time into creating grants, and it's, as you've mentioned already, it's not always successful or an easy path. What advice would you give to someone who feels they can't be successful because of a language or content barrier? That feeling of, I just want to give up. Do you have any advice for people?
Yeah, you just got to not really give up. Like, you learn a lot from just getting rejected, I think. And like, as long as you have a really good reason to keep going, I think that's the main thing. So I think you just got to really look hard at what you're trying to do and just make sure there's a really good reason for doing it. And that will kind of get you through the rough times of getting rejected from grants. Because, I've been rejected from grants. It sucks. But luckily, after I started working with you guys, we've got a lot of grants. So it's been, I'd say, just try to reach out. Like, if you can reach out to Thin Air Labs, they can help you out a lot. or just reach out to other people that have done grants before, because there's a unique skill set there that's often hard to go through yourself. And if you're trying to do all the writing yourself as a founder, it's there'll be a lot of trial and error and a lot of pain. So I'd say just reach out to people that have been successful, and you could probably just pick up a lot just from conversations like that.
Yeah, absolutely. I think that's a great point. And I would say as well, there's often points of contact in all these granting agencies that are extremely helpful and willing to give advice. And most granting agencies will give you direct feedback as to why, you weren't accepted at this point, and maybe what milestones you would have to hit in order to be competitive for one of those grants. So I always advise people as well to use the resources that exist, because, people within different granting agencies are the experts in their own grants, right?
Yeah. And like, just be transparent, because those people are great at helping you. Like, you don't have to have all the answers. You just got to tell them what you don't know, and they'll often help you out.
Yeah, absolutely. And sometimes, sometimes it's just not your time. And I know it's tough feedback to have when you're put work into writing a grant, and sometimes you get outcompeted in the pool, and it's a tough pill to swallow. I mean, my background's fully academic in the science industry, or my whole livelihood in the lab was the cycle of granting and trying to fund products. So it's a familiar feeling for, I think, everyone, probably most people in the room.
Totally, yeah.
We do have another question coming in here, Steve, for you. And I think I can probably answer this one for you. But they're asking how your ultrasound is different from the ones that are already available. But I'll let you answer that one first.
Yeah. So we're not actually developing an ultrasound device itself. We're developing a web-based platform that can integrate with any ultrasound device. So what's really different about ours is, I guess there's a few different classes of products that exist out there. So number one is the devices themselves. A lot of them don't even have cloud systems right now, but you can actually export them from the devices and put them in clouds. So that's one kind of class device. We're different because you can actually have a cloud-based interface into this. Number two, no one has developed an ultrasound guided therapy platform, so no other product is designed for serial quantitative analysis of ultrasound devices and scans. Number three, there's not really kind of a ultrasound device agnostic solution out there. So there are a few ultrasound device companies that have their own clouds, but they're essentially kind of like my device or go away kind of thing. So that really restricts what you can actually do, because a lot of these sites have multiple ultrasound devices on them. And really, I think there's a big opportunity to make it a bit more open and interoperable in terms of connecting all the ultrasound devices that exist out there and making it accessible to people. So yeah, fundamentally, there's just no product out there that can allow you to easily quantify ultrasound scans over time. And secondly, there's not really like an open platform out there that can upload all these scans to.
Yeah, absolutely. And I think the approach you're taking is great, where you're taking a completely device agnostic approach. So it's not like a clinician that wants to adopt your technology has to go out and spend thousands of dollars adopting new hardware, right? That it'll just sync in with hardware that they may already have access to.
Definitely. And the ultrasound devices are rapidly changing. So like eventually we have the idea of maybe developing our own, but we're kind of want to partner with as many people that are developing these things, because it's just changing so fast right now. And there's so many different ways you can create these devices too. Yeah,
absolutely. We're coming to almost the end of our time. That 30 minutes flew by. But Steve, I did want to give you a chance to have an opportunity, if you want to talk about anything that you might need help with going forward, if there's anything in the audience that the audience might be able to help you with or connect to you to help with. Now's your chance.
Sounds good. So yeah, in general, things are going quite well right now. I think I'm always looking for new ideas to come up with creative ways to fund this going forward. So I probably don't know every way that you can go out and fund something like this. So if anyone has any kind of non-traditional ways of funding these things, I'd love to chat with you.
Awesome. Thank you so much, Steve. For everyone here today, thanks so much for joining us. We're really looking forward to finding more ways that we can work with you, Steve, in the future, and connecting with some people that are here in the audience. If anyone ever wants to reach out to us, we're always happy to chat about what we might be able to help you with on the Funding Catalyst team. Our email address is on the slide there. And if you want to reach out to Steve, his email address is there as well. So thank you so much for everyone for joining us. And Steve, thank you so much for your time.
Yeah, thanks for having me. It was awesome.
Thanks, everyone. Take care.